Now we move to Africa, and we have Fatima Elomari as our next speaker. Fatima, could you hear us?
Thanks, Alex. Thank you. And good morning, good afternoon to everybody. My name is Fatima Elomari. I'm professor of psychiatry and addictology at Rabat Medical School in Morocco. I am the president of the Moroccan Association of Addictology. So first of all, I would like to thank ISAM for organizing this General Assembly and for this global network. The Moroccan Association of Addictology is young. We have only 8 years history. It is the first association created in Morocco by professionals involved in addiction, treatment, research, and prevention. And membership extended to all medical professionals like addictologists, psychiatrists, general practitioners, other medical doctors, and also psychiatrists, nurses, and researchers. The AMA is also considered as the Moroccan Ministry of Health partner and reference on addictology. Our association has many priorities, and one of them is capacity building. AMA organizes scientific meetings, trainings for health professionals. AMA is also promoting standardized approach on treatment prevention and harm reduction in Morocco. AMA is involved in policies and politics on drugs and addiction treatment with the Ministry of Health. And it is promoting an evidence-based approach on considering human rights. AMA is organizing an annual congress, often with collaboration with national and international society on addiction medicine or on psychiatry addiction. AMA also provides trainings and contribute to national strategies on addictology. And AMA is tending to establish addictology as a medical specialty. Funding a sponsor is one of our association challenges. AMA is also tending to establish an addiction treatment guidelines and also to develop prevention programs. Next, please. So our organization is expecting ISAM to provide global network of association and professionals in medicine addictology to make guidelines on addictology for treatment prevention and harm reduction, as well as a global training and research. Our organization can contribute to the global community of addiction medicine with the scientific and research collaboration, sharing experience, clinical experience, helping providing training, and also hosting ISAM Marrakesh 2023. So you are all welcome to this event in Marrakesh in October 2023. And thank you for your attention.
Thank you very much, Fatima. Now we move to Emira Khelifa from Tunisia.
Hello, everybody. So I'm Emira. I'm the treasurer of the Tunisian Society of Addiction Medicine, STADD. Next slide, please. So STADD is a scientific association founded in 2015 by professionals, mostly psychiatrists, but also psychologists, GPs, infectious disease specialists, working in the addiction field in Tunisia. The STADD advocates since its creation for a drug policy in Tunisia consistent with human rights standards and gender approach. So STADD had set up the first university diploma in addiction in Tunisia in the Faculty of Medicine of Tunis with the help of the Group Pompidou of the Council of Europe, and organizes many training sessions and prevention actions. So priorities of the STADD are to have a drug policy that recognizes addiction as a public health priority, to help establish a day unit for women with a substance use disorder in Tunis, and to implement prevention programs with international standards, prevention programs that works. So please, next slide. So we expect ISAM, first of all, to accept our application to be a member of the ISAM, to be an affiliate society, and to promote research in the addiction field in Tunisia with a focus on gender approach and neurobiology, to improve addiction training in Tunisia, and to help us align our practices with guidelines and to provide an access to latest practices and research findings. So we can contribute with the development of research and protocols within the community of addiction societies, to collaborate in international studies, and to share knowledge and experience in a regional and international network, and to welcome you all in Tunis. So thank you.
Thank you, Emira. And just to let you know, we'd be honored and delighted to have you as an ISAM affiliate member. And also, we look forward to the 25th anniversary, shout out to Fatima, of our conference in Marrakesh next year in 2023. 25th anniversary of ISAM. We hope all of you can join us then.
Awesome.
Yes, for sure. Thank you.
And now we have Mustafa. Mustafa, could you hear us?
Yes, I was muted. Good morning, everybody. So thank you, Hamid and the team at ISAM for inviting us. I am presenting. I'm a professor here at the University of Minnesota, but I'm presenting here on behalf of the Africa and Middle East Congress on Addiction, AMECA. So AMECA was established with the specific goal to promote scientific research and training in the field of addiction and related mental health issues in Africa and the Middle East. So during the last 10 years, we have worked with more than 800 colleagues, trainees, scientists, and clinicians who have participated in AMECA activities, be it as presenters, co-leaders of certain functions, collaborators, etc. These colleagues and participants come from more than 36 countries in Africa and the Middle East. We've had colleagues from European countries and from the US. So many of these colleagues also co-led and participated and are still engaged in some of our scientific outreach. We continue to work promoting access to training opportunities and scientific exchange. Recently, we've moved some of our work to remote activities using Zoom and other technologies. So while in-person functions have been canceled or delayed due to COVID pandemic, I think only online functions have continued to grow, including a recent successful webinar series in partnership with the University of Minnesota. As to challenges and needs, I'd say identifying local, interested, and engaged collaborators and partners to spearhead and lead initiatives is an important need and challenge and goal for us. Next slide, please. So as to our experience and hope for future collaboration with ISAM and many of you, we hope to make available opportunities for research collaboration, since that is a primary mission for us. And to that end, facilitating contacts with collaborators from other countries could help many of us and many junior colleagues in the region. So we all hope to collaborate on local and regional formative research and training activities. We feel that we're all well positioned because of conversations like this to help establish links to access and harmonize research efforts in the region. Also, as we have done in the past, we hope to provide support when available for trainees from the region to participate in our research and other formative training activities. So if you need any information, feel free to reach out to our website is iameca.org or email me directly. And of course, through ISAM, I hope we can facilitate more and more interactions. Thank you.
Thank you very much, Mustafa. Thank you very much.